Dear friends, welcome back to the fourth episode of our ultrasound training course. I was not able to upload the videos for quite some time, but you people insisted too much, so I'm again going to restart this series. And now we will upload one episode every week on Friday night. Every Friday night, I will be going to upload one episode. In today's episode, we are going to visualize the right kidney. For visualizing the right kidney, we have two important factors: patient positioning. We have to try to visualize the right kidney in two positions. One, when the patient is lying supine, and second position will be when the patient will be tilted toward his left side, so the right side will be up. So let's start. I will be using my curved array probe for this purpose. In the same way as I have previously shown you, we will apply the gel, and this way I have applied the gel, and now I will put my probe in the right lumbar region. Here I can visualize the liver. This is the liver, but right now liver is not of my concern. So I will tilt my probe a little bit downward, a little bit. I'm saying a little bit, not too much, and I will move toward the mid axillary line like this. And here the kidney has started to appear. Now I will ask the patient to take a deep breath. एक लंबा सांस लें, तो रोक लें, लंबा सांस लेके रोकें. Take a deep breath and hold it. लंबा सांस अंदर लें, रोक लें. This is the right kidney. This is the whole right kidney. You can see that I have moved my probe just a little bit. This is normal सांस लेते रहें. This is the liver and this is the right kidney. Now I have to visualize the kidney in its whole length. This is the this is renal cortex, and this is renal medulla. This white portion is the renal medulla. I will look for any stones, any hyperechoic object, any cyst, any hydronephrosis. What they will be look like, I will tell you in the coming episodes. Till now, we are going only to learn how to visualize the kidney. Now we will come again. I started from the right lumbar region a little bit anteriorly, and I started moving my probe just a little posteriorly, and you can see that just by a slight movement of the probe I can visualize the kidney. You are not supposed to move your probe like this. No, just move a little bit downward and you will be visualizing the kidney. Now I will ask the patient to turn to the other side. It is very important to visualize the kidney in this position also, because many things will be visible in this position. Now I am keeping my probe at the same position, and this is liver. When I am looking at the liver, I will tilt it a little bit caudally towards like this. My probe position is same. I have just tilted it a little bit caudally and laterally. You can see my probe position. So this is the kidney. I can see the whole kidney. The whole kidney is completely visible to me. Now I have to take the measurements of the kidney. This is the upper pole of kidney, this is interpolar region, and this is lower pole. I will start from the upper pole. From here to here, it is the length. It is 10.2 centimeter, which is normal. This is the width, 3.7 centimeter, and this is the cortical thickness. All these three measurements are important. I will record all these three measurements. So, if one important thing, if I am unable to visualize the kidney in both of these positions, I can approach a posterior position also. I will ask the patient to move a little bit further, or I can put him in the prone position. Here I am visualizing the kidney from the posterior side. Here you can see in the right lumbar area, I am applying a bit pressure on my probe, and I will be able to see the kidney, and it is moving with the breath movements. So this is about the visualization of the right kidney. We will be back with our next episode, in which we will talk about visualization of the gallbladder. Till then, thank you so much. Allah Hafiz.